For this assessment, measurements should be taken on the right side of the body. Skin should be dry and lotion-free on the subject. Measurements should not be taken immediately after exercise, and halfway mark should be marked on the subject with a marker or a pen. For skin fold measurements, a caliper and a measuring tape will be needed. First, you want to make sure that the caliper is working properly. You will place your hands around the handles, press down on the leverage to make sure that it is working functionally and you can read the numbers. You will pinch the area and you will place the caliper 1 centimeter away from the thumb and index finger and wait 1 to 2 seconds before reading the actual measurement. At this point, you will start measuring halfways at each of the 7 skin fold sites. First, we will go ahead and look at the chest, and it is 1/2 the distance between the anterior axillary line and the nipple for men, and 1/3 of the distance between the axillary line and the nipple for women. Next, we will go into the triceps, which is the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely to the side of the body. The third one will be the suprailiac, which will be in line with the natural angle of the iliac crest taken in the anterior axillary line, immediately superior to the iliac crest. Then we have the abdominal site, which is 2 centimeters to the right side of the umbilicus. The next one is the subscapular, which is a diagonal fold 1 to 2 centimeters below the inferior angle of the scapula. Next would be the thigh, which is on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease of the hip. Lastly, the mid-axillary would be a vertical fold on the mid-axillary line at the level of the sphenoid process of the sternum. As we continue this assessment, the marks on the subject should already be marked and ready to go. We will first firmly grasp the skin site and shake to separate the fat from the muscle as we hold our caliper firmly. We will then place the caliper 1 centimeter away from the thumb and index finger and take the reading within 1 to 2 seconds. As we continue to do this, we want to make sure that we are rotating within each site to allow the skin elasticity to return to the original state. And this typically takes about 1 to 2 minutes before retesting an area again. Each site will be measured either diagonally or vertically. The chest site will be measured diagonally, the triceps vertically, the suprailiac will be measured diagonally, the abdominal site will be measured vertical, the thigh site will be measured vertical as well, and lastly, the mid-axillary will be measured vertically as well. A minimum of 2 measurements at each site will be taken. If the duplicate measurements are not within 1 or 2 millimeters, you will have to retest this site. After having taken both measurements for both trials, we will calculate the average for each skin fold site, and by this we will be able to use the skin fold equations to calculate percentage body fat. Females will have higher chest area readings due to the fact that sports bras are worn while men do not. So the 3 equations that we can use to assess body fat is the Brozek equation, the Siri equation, and the body density equation. And we can see that the body density equation has 2 different equations, one for men and one for women. And they will be calculated using the averages of the skin fold sites and age.